Thank you so much. And Excellencies, distinguished delegates, development partners, colleagues, ladies and gentlemen, it is an honor to join you during the 79th World Health Assembly and to participate in this important dialogue on financing non-communicable disease for impact. Somalia highly appreciates platforms such as this side event that continue to place sustainable financing for non-communicable diseases at the center of the global health agenda. Across many fragile and low-resource settings, non-communicable diseases are no longer future challenge. They are present reality placing increasing pressure on households, health systems, and national economics. For Somalia, the challenge is particularly complex as we continue to front communicable diseases, humanitarian crisis, displacement, climate-related shocks, and growing burden of chronic diseases. In this context, financing non-communicable diseases is not only health priority, but also development and economic priority. Somalia believes that sustainable non-communicable disease financing must strengthen resilient and integrated health systems capable of delivering prevention, early diagnosis, treatment, rehabilitation, and long-term care in an equitable and people-centered manner. As we move toward the 2030 Sustainable Development Goals, Somalia is prioritizing stronger domestic resource mobilization, innovative financing approaches, and integration of non-communicable disease services into primary health care and universal health coverage reforms. We are also strengthening community engagement by involving people with lived experience, community health workers, women leaders, and civil society organizations in building more inclusive and responsive health systems. Recognizing that financing remains a major barrier to effective non-communicable disease response, Somalia is developing national financing framework to mobilize sustainable resources for non-communicable disease prevention and control. Current efforts include exploring taxation on harmful products, strengthening health financing reforms, and integrating non-communicable disease priorities within broader universal health coverage efforts. Somalia is also prioritizing financial protection mechanisms that reduce barriers to accessing essential non-communicable disease services, particularly for vulnerable populations and people affected by crisis and displacement. Somalia firmly believes that sustainable non-communicable disease financing must support integrated health systems rather than fragmented vertical programs. We are embedding non-communicable disease services within the essential package of health services while strengthening implementation capacity across federal and state levels. Our national goal is to increase primary health care facilities providing non-communicable disease services from approximately 29% today to more than 90% by 2030, particularly in rural and underserved communities. By bringing services closer to communities, we can reduce late diagnosis, prevent complications, and lower long-term health system costs. As an important pillar of this effort is the expansion of WHO-banned interventions within primary healthcare systems, alongside training healthcare workers to strengthen early diagnosis, referral systems, and long-term management of chronic diseases. Somalia recognizes that health systems alone cannot address the growing burden of non-communicable diseases. For this reason, we are developing multi-sectoral national NCD strategy for 2026-2030, addressing major risk factors including tobacco use, unhealthy diets, physical inactivity, and air pollution. Prevention remains central to sustainable financing and long-term population health outcomes. We are also integrating non-communicable disease considerations into emergency preparedness and humanitarian response planning to ensure continuity of care during crisis. Somalia deeply value collaboration with WHO, the World Bank, Access Accelerated, the Coalition for Access to Non-Communicable Disease Medicine and Products, and other partners supporting innovative approaches to financing and equitable access to non-communicable disease services. Excellencies, distinguished guests, as we look toward 2030, financing for non-communicable disease must become an integral component of universal health coverage, primary health care strengthening, and broader development financing. Fragile and low-income countries like Somalia must not be left behind in the global non-communicable disease response. Somalia remains committed to translating political commitments into measurable action through stronger financing systems, integrated health services, community engagement, and multi-sectoral collaboration. The challenge before us is significant, but meaningful progress is possible when political commitment, evidence, partnerships, and sustainable financing come together. Thank you very much.